Pam, thank you so much for joining me. With Enhanced Recovery After Delivery, you've been a really crucial part of this journey that we've been really focused on enhancing and improving the experience that any woman has after any type of delivery. And just really communicating that they have the opportunity to have an occupational and a physical therapist on their birthing team. And so I really want to thank you for sharing your story. Can you introduce yourself and just give the name of the place you gave birth the first time?
Sure. So my name is Pamela Daniels. I am a mom of two amazing boys. My first birth was actually at Clara Matt's Medical Center in Belleville, and my second was at Beth Israel Medical Center in Newark.
Honestly, I think about September 2020 a lot. Can you take just us back to that moment? Just even from the text message, if you remember texting me right after you had your C-section, what was going on?
4 years ago. The little one's turning 4 in a few weeks, so
yeah.
I remember being in pain. I remember realizing, like, how am I supposed to get out of bed and walk down the hall and see my kid, who actually ended up in the NICU for the first couple of days. And I remember trying to figure out how am I supposed to go to the bathroom. I was in the same room, and it was during COVID, so I was by myself. There was no one there with me, and I think there was God who just put the thought in my head, like, Dr. Seagrace is a physical therapist that specializes in pelvic health. Why didn't you call her? Now, I did wish I had the thought maybe a day before, but thanks God, And I remember reaching out, like, hi.
I get this text message, I kid you not, like when I read it, it didn't occur to me that first of all, you had a baby and then you had a C-section. So I got a text message and, I'm reading it and it's like, this C-section pain, like the C-section pain. And I remember reading that and I'm just like, okay, Pam had a C-section. I'm seeing photos that are coming in now. I'm seeing you had the nasal cannula, so you had oxygen. So I'm like, okay, she had surgery. And when we talked, you were just talking about how painful it was, but specifically with like getting in and out of bed. Because at that point, you weren't in a wheelchair going down to the NICU. You were walking back and forth.
Yes.
Yeah. So like what were you feeling? What was going on?
I was feeling like, how am I gonna do this at home? That was just like the main thought in my mind. And it was a struggle because, when they would bring me JB, I would have to sit up in the bed. I, was holding him, trying to nurse and learn how to even do any of that stuff. And it was just painful to be in, the different positions and maneuver myself. And of course, everyone is telling me, you need to move, you need to walk, you've got to be able to get up. And the NICU was actually on the same floor, just way down the hall. That just felt like it was very far away. And I was going there, to at least twice a day, and so, yeah, I just remember trying to figure out why, or how did I get here? And, how am I going to do this going forward? I was getting a lot of, they were telling me what to expect in the healing process. They were telling me that it's going to get worse before it gets better, and yeah, it was a lot to process.
Yeah. Take me back a little bit before the C-section. Like what led to having a C-section? What led you there?
That's a great question. Don't fully know. All I know is that I was what they considered overdue. I actually had gone home. My due date came. They said I wasn't, we can wait some more time. I think it was like 1 or 2 weeks. And I was induced. Actually, they said they were going to need to induce me. 'Cause by the time I came back, I wasn't dilated. The show had not started apparently, and so they were saying like we need to induce you and trying to explain the procedure for that. It didn't sound lovely, and we tried the induction process first. I'm like recalling these things. We tried the induction process and it was excruciating. But I went with it. I went with the process. I said, okay, let's do this, and that took a couple of days. We went through, and I hadn't dilated at all, really. And so the midwife, there was a midwife there. What's the other one called? The midwife and wasn't a doula. Was she a midwife? I believe she was a midwife. She was explaining to me basically saying like we're running out of time, by the third day I believe, and it's probably best that we do a C-section, and I had someone else I did consult, a homeopathic doctor who was saying get out of there, go home, do it on your own. But what happened was because of the balloon process that they did, with the C-section, they burst they what is it called?
I know what you're talking about.
Like
so you had an amniotomy, so they like broke your water. Is that right?
Yes, they broke my water.
Okay.
Mm-hmm. And so they said, well, we can't let you leave, like this. So you have to stay. And basically, you're running out of time to get your C-section. You don't want anything to happen. There's all these threats of potentiality, right? If I don't make this decision. And I said, okay. I remember it was about 4:00 in the afternoon, and I had him at 4:30.
Wow. Okay. So then after that, a lot of what I would look at, you were like, Dr. Seagraves is a physical therapist. Like we've known each other for how long, right?
Many years.
Right? Yeah, since diapers.
Mm-hmm.
And so even around that time, I think I was explaining to you, I'm working in the hospital. I'm seeing women after birth. But around that time, I think your doctors were like, why do you think you need a physical therapist?
Yeah.
I was asking a lot of questions. I was like, Pam, do you have stairs you need to go? Who's going to be, with you? And you were like, I'm going to be by myself. Mm-hmm. Yeah, I'm going to be going upstairs. Mm-hmm. Yeah, I'll probably get a taxi to go home or something like that. And it was just like, I was hearing a lot of, I'm going to be alone. Mm-hmm. So I was just like, Pam, we got to pump the brakes. They can't discharge you alone. And this is a big surgery that you just had. But what was the response from your team when you relayed that information? Do you remember?
Yeah, I remember requesting the physical therapist. And I remember the nurse, saying why, like, why do you need a physical therapist? And, I said, well, I'm not exactly sure about, how I'm going to make a maneuver, especially when I get home, and try to explain those things. And she said, well, I have to, speak to the attending or whoever was there. And so, she asked a few questions, and I think there was still pushback. And the thing, it wasn't until you got on the phone just explain a little bit more to them what could potentially why it would be needed, that they're like, okay, I guess that does make sense. She does need to know how to come in. Maybe we should bind her, maybe we should, show her how to get out of the bed the right way. And so those exercises that were done, to walk me through those things didn't happen until, the advocacy started.
Wow. And so in terms of even the binder, you were getting in and out of bed, but it was a hospital bed, right? So you were using the thing.
Mm-hmm. The armrest.
The armrest, all of that. When you say bind, so you had not been given an abdominal binder.
Correct.
Up until that point.
Correct. And then they had to find one because, slightly larger in size.
Right.
And so they had to find one that was appropriate for me. They had to make sure it was administered correctly. I think you actually, talked to them about, those things as well. And all of those things had to be requested.
Yeah. When you had the binder though, because that was a big thing, it wasn't really fit. It didn't fit well though.
It wasn't tight. Right.
Yeah. So even though they found one, it still wasn't like the right size. So it didn't really give you that support. What ended up working during that hospital stay? Like what all did you have from the physical therapist that made a difference? If you could remember.
I think when we maneuver, we take for granted what we do first, right? Like we kind of hop out of the bed with our head first or with our shoulders first, right? And you learn very quickly you can't do that, right? And so I think the physical therapy, allowed me to to move with my legs first, to how to use my upper body strength, to move. And I think probably should have had a little more because again, the thought process of the order in which you complete a task needs to be first, right? And that takes practice to really get into that. And we had our crash courses in it, but I ended up at home sitting on the bed, and I had the baby at the end of the end of the bed, and I reached forward. I remember reaching forward to get him, and it just felt like a split occurred on my side. It was awful. It was extremely. I can still remember the pain to this day. It felt like I ripped, my stitches or staples, whatever the case was, and it caused some kind of rupture, and then we had to go through the healing process for that. So when that happened, went back to the doctor. They were prescribing antibiotics, but again, saying that when you take the antibiotics, the wound is going to turn into some kind of mess, right? And it's going to get worse before it gets better. And I wasn't happy with that response. So I took another route, unbeknownst to my doctor. This is not against medical advice. But I took another route and took a homeopathic route to actually heal the wound with your support in terms of learning about compression and going the compression route, which was amazing because I literally watched this wound heal, like progress, like every single day. Like you made me take pictures every day of it and see what it looks like. I'm like, this is disgusting, but you want to see it? I'm gonna show you.
Yes.
But you're like, oh, that wound looks great. Like, I'm like, weirdo. But I noticed, like, I have to believe my eyes. Like, I definitely saw the pain, threshold, definitely lessened over time. And it was healed, within a couple of weeks. And I remember going back to the doctor who wasn't expecting to see it healed, like, and I didn't say anything. I didn't tell him I didn't, take his antibiotics, but like, thank you.
Yeah. And do you remember, because since the binder didn't fit really well, what compression do you remember you using? I remember you showed me this picture.
Yeah. Right. So I actually used pads. Like I, protected the wound with a few pads, and I actually I ordered another kind of binder, if you will, that was more like a tube that I put around me, and then that created some tightness. I was mindful, like the kinds of like tights and pants that I wore to try and keep the support there.
Yeah, no, absolutely. And I mean, because we talk a lot about, when I'm training therapists, like, you have to try a lot of different options. Like these are not one and done visits. You even said so yourself that was a crash course in the hospital, but you probably could have used some support ongoing. And so, like, my last question is this, like, for the pushback that some therapists are getting, like, that therapist who saw you even needed a little coaching.
Oh, absolutely.
Right? She needed a little coaching over the phone because she was like, I don't see patients on that unit. I don't go to the maternity unit, right? So she was actually sitting on the order. I don't know if you remember this. She had the order from the doctor.
I remember that.
And she did not want to go, and I had to call.
There were several phone calls you made to get to the boss, essentially.
To the actual, like, right, I need you to go to this unit.
To send someone to this room. Yeah. And that wasn't until that happened that they came.
Why do you think it's important that women know their options for at least having that kind of guidance after a major surgery? Why is that important to tell women?
Well, I think it's important for women to know that there are options in the first place, right? That there are there are things that you can prepare for, but then there are also additional supports available in the event that you're dealing with something, and that just because a recommendation is made, that doesn't necessarily mean that's the thing that you need to move forward with. And I learned that even more so in my second birth, even more so than in the first. Yeah, because we feel like doctors are all knowing, right? That they give you they give you the right answer the first time, and that's law, right? And that's just not the case. And, when you have a birth team, that considers the whole person, the whole experience, the healing process, then the conversation is something different, right? And when your team values what you're experiencing and believes what you're experiencing, and is listening out for, those things, when you're heard, it makes the experience something completely different. And that's what I experienced.
You mentioned team. At any point during your first birth experience, right? Did your team ask you about the support you would have at home? Stairs up to your house, what
No.
your home looked like at any point?
No one asked if I was in an apartment, in a house, if there are multiple floors. No, do I have a platform bed? Nothing. There was no consideration of what would happen when I went home.
So how did they know you don't need therapy, you don't need rehab, you're going to be fine? How did they know how you were going to be in your own home by yourself?
They didn't. I think they just, they'll find out what happened when you come for your follow-up, whenever that's scheduled, and
Right.
that's it.
So then why do you think that it's just any woman should know, like, hey, if you had a C-section, you weren't planning for it, why is that important that you get help?
I'll answer that this way. You were the first person to tell me that a C-section was cutting through 7 layers of my body, and that was a major surgery. And I don't even think in the time I understood what you meant by major surgery, but I remember you comparing, I think, to a hernia that a man would receive, and how that's major abdominal surgery. And so putting that in perspective, this is kind of a big deal, right? And so I think that's the most important thing to remember, that this is a major surgery. Major surgeries have, a care path that should, encompass what rest actually looks like, and if it's actually a thing, right? And a new mom doesn't get to rest, even with a good support team, right? It's still, a mom is always going to be on call, right? And so, yeah, it's just it should be a part of intake or release at the end of the day.
Yeah.
How like you said, what is the support system? How are you, what movement will you be required to do? Do you have to rest? I mean, I have, colleagues and friends who had a C-section and went back to work in 6 weeks, in pain, dealing with issues, but that's what they did. And if they have to do that, why not set them up for success by being able to not only in the hospital have that kind of service, but also in the return to home, in-home visits, during that initial 6-week period. Why wouldn't a physical therapist or occupational therapist be able to check on a mom and support, what's happening in the home? Or even a doula, a doula who builds a relationship with the mom over time and has a lot of those experiences. Why wouldn't she or he be able to do that? Yeah, it's just, once the hospital is done with their part, that's it. And that is something I think needs to change.
I agree. I'm going to bring you back to something that you said. You said that you knew a lot more going into your second birth.
Yes.
Explain that, yeah.
Well, I knew I had 3 rockstar doctors and physical therapists in my corner, which I called ahead of time this time. And I also knew that going in that I didn't have to be a yes person, right? Like, I knew that. I had a doula with me. I had, a friend who happens to be a physical therapist, not specializing in pelvic health, but happened to be a physical therapist, there was able to support me. And
who's the other one? Who is the other physical therapist? You mentioned 3.
Oh, yes, yeah. Oh, well, Dr. Catherine Sylvester, yourself, and Dr. Genesee Grace as well.
Yeah, no, Catherine Sylvester for sure. So she's the founder of Operation Miss. Tell me a little bit about her and your interaction beforehand. What did she talk about?
Dr. Catherine whew, was amazing. I mean, literally, Dr. Catherine was going head to head, was through me, but going head to head with the chief of the labor and delivery unit, okay? Who looked like this mob boss with his gold chain, okay? And was like, when are you having this baby? You know, like every day he was asking, when are you having this baby? You know, are you still gonna hold out? I mean, up until the last day, you know, that was his approach. That was what he was saying to me. And I felt stronger, you know, in the room. I wasn't up there the entire time, right? There were highs and there were lows. There were times where I did feel a little defeated, but I had the team to continue to encourage me and recognize that there were successes happening. Like we were progressing. Like the idea of progressing was not wasn't present last time, right? Or even really understanding that. There was a whole kerfuffle with with my epidural when I eventually ended up getting an epidural and learning that there's fentanyl in the epidural. That was news to me, and because I was able to check this information against my team, I learned that you don't have to have an epidural with fentanyl in it. And even though they had started the line for it, they can change it, you know. And I remember asking the anesthesiologist the questions, you know, that I was supposed to ask him, and he was pushing back. Well, this is the most recommended, you know, this is what's recommended for my, but does this have to be the case? And with some nudging of him to give me the answer, he said, well, no. Well, what are your options? Of course, I don't know what these big words are that he's using, but I'm like, this is what he said, right? And then she's like, well, ask him if he has this. And so I gave that. He's like, yeah, we have that. All right, let's go. Switch that out, bruh, okay? And I felt the changeover, right? Like I felt the stuff leave and I felt the new stuff come in. I mean, it was just fire in my back, you know, crazy. But just advocating for myself, for what I want, what I didn't want. Even with we had to go through a whole induction process again this time, and that awful balloon. However, again, it was a much different scenario. There was, you know, some progress that was made. You know, we did the Pitocin.
Yeah.
Right. We did the Pitocin, but we didn't do the Pitocin the same way this time that was done last time. So last time, the Pitocin was basically turned up immediately, the whole period, like the whole time that, you know, I was given the measure. And this time we did incremental, you know, notches up, and we stopped. We turned it off, right? Which was like, what are you talking about? You're turning it off. We don't do that here, right? But I'm like, okay, but you're gonna now, you know. And we reset. And actually, the night we turned it off was actually a night that I felt really defeated, right? Like I felt like we weren't where we were supposed to be. It wasn't progressing where it was. You all were being very encouraging and stuff. But that morning, the next morning, between the nursing staff who came in just like, okay, today's a new day. We're gonna do it this time, starting all over. There was another nurse that came in and was like, when's the last time you took a shower? When's the last time you ate? We're gonna get you some food. We're gonna get you a shower. I mean, just, it was amazing, amazing energy. Just shout out to the nurses at Beth Israel that day who were really rock stars as well. And they found me a shower curtain because there was no shower curtain in the room. She's like, you know what I had to do to get you this shower curtain, but we got it, okay? And it was, ironically, her name was Karen, so yeah. And there was another nurse that ended up like staying in the room. She was like, I'm with you. They're like, you gotta get this going. So she was helping with the ball, and I mean, it was just amazing, amazing energy. I actually had a doula. Like I said, I had a doula this time that was actually the backup doula because the doula I hired went on vacation, and because of the delays and, you know, it just, the clock ran out on her being there. But I had a backup individual that came who was just dynamic, found the right spot in my back that every time that the pulse came, she was just right there with me. I mean, so the team dynamic was just amazing, and yeah, I delivered a baby after a C-section, which made it to the other side of the room, other side of the hospital. I mean, I was the girl who had a VBAC that no one believed was gonna happen. And that felt pretty cool too.
Wow.
My body did this.
You felt powerful. I remember you were up the next day and I was just like, how are you doing?
I chased my son out the room and he came to visit, and I saw he ran out the room, and I'm like, I ran again. They're like, damn, are you all right? Like,
yeah, I just had a baby.
I got myself some coffee. I'm good. Right.
I will say this. I told someone your second birth story, and they said, I'd never heard of them being able to turn off the Pitocin. Like when they heard that you were getting out of bed, taking a shower, I think you were on the ball, the birthing ball.
The ball was great.
Like this is all after you had an epidural at that point. You had the Pitocin at that point. And you were able to just shut it down and say, no, I'm gonna give my body a break. And that's when I was hearing what Dr. Catherine Sylvester was saying to you. She was like, no, your body needs a break, so you're gonna take a break. She was just,
so you're gonna go to sleep.
You're gonna go to sleep.
You're gonna eat.
You're gonna eat. Like you're
I
not
had smuggled food too, so I had food in there. They're like, when's the last time you ate? I'm like, well, legally, a couple days ago. Illegally, I got a salmon wrap over here. Okay, so we're okay.
So you just did it differently this time around.
Absolutely.
Like you did it completely differently. You did it on your terms. You stood your ground. And you had a delivery when they told you you needed to have a C-section because your placenta would be dried up.
Yes.
Right? Your placenta was drying up.
Yes.
I think I kept hearing. I even asked you, I said, Pam, do you really need to go to the hospital right now? Why don't you stay home as long as you need to?
I walked a mile the morning I gave birth. I took my car to the mechanic, and I walked from the mechanic in Union down to my house in Newark, and then I had to be, so because at the time I had to go in like every other day, right? Because they're like, oh, you need to hurry up and come in.
Yeah.
So I had to go in every other day just to do the checkups and everything. And that same day I just went, just to follow up. I did my walk, dropped the call off, and then went to took Uber to the doctor. And they said, well, it looks like there's no more water, or it's all dry, and now the baby is in jeopardy of shoulder dystocia. That was the one that everyone just kept saying shoulder dystocia to me, like, I'm being irresponsible because I'm threatening my child might have this shoulder dystocia. Then the threats were around the size of the baby, right? So in like a 2-week time, the baby went from like 6 pounds, the 8 ounces to it could be. The baby could be up to 10 pounds, and then how you won't be able to deliver him. So we just need to do a C. I mean, it was just everything was just fear mongering, to me. But I wasn't gonna handle that. I was really just like, okay, these are possibilities, but is that exactly what you see? Or are you just threatening me? So I actually didn't. They were trying to send me directly from there to labor and delivery. And I said, well, look, I didn't arrange for my kid to be where he was supposed to be for the delivery yet. I didn't bring my bag with me. Like, you guys are not about to rush me off to the hospital and just, force me into a C-section. So I was able to handle everything I needed to handle, took myself back, and we started this process now.
All right, so one last question. So you said you had 3 physical therapists on your team for the second birth. So any mom who, ideally has the dream team, why would you advocate that they have an occupational and a physical therapist in addition to a doula? Or would you? Would you say?
I absolutely think all 3 are necessary. I think the doula is great for the general birthing plan, for you to really, put yourself in the mindset and spiritually, physically, all leading up to it, right? So however early you can contract one, just allowing he or she to be part of that process is just a piece of having that support. And then I think the preparation of movement, whether you have either delivery, like how your body is different, your physiology is different after you have a child. So being able to prepare yourself for that is a conversation with a PT or OT. And then in the event that something acute and does happen, if you have a required physical therapist, then they should already be part of that conversation to help you prepare for what that will look like. It's essential, in my opinion.
Thank you. Really. And thank you so much for your share. Really.
Most welcome. Happy to share the story and hopefully help prevent more unnecessary C-sections and to help strengthen women's abilities to walk into the experience in control.